welcome to our show, Health and Wellness Myths and Facts. We all know how much women struggle and multitask to maintain their work-life balance. However, in this battle against time, they neglect their health, consequently leading to lifestyle-related diseases like obesity, hypertension, stress, etc. Now, obesity negatively affects women's health in many ways. Being overweight or obese increases the relative risk of diabetes and coronary health disease in women. Women who are obese have a higher risk of lower back pain and knee osteoarthritis. Obesity also has a negative effect on the contraception. This is the contraception as well as fertility. Maternal obesity is associated with high rate of cesarean sections as well as higher rates of obstetric risk diseases such as diabetes and hypertension, hormonal fluctuations during the female lifespan that may explain the increased risk of obesity in women. Knowledge of these factors allows the development of targets for prevention and early intervention. The theme for International Women's Day 2023 focuses on gender equality. Therefore, in honor of International Women's Day, our men endocrinologists panel will discuss obesity, prevention and management in women. So we have with us Dr. Nilesh Lomte, consultant endocrinologist, hormone care from Aurangabad. We also have Dr. Shyam Kishore Diabetes, Thyroid and Endocrine Clinic in Patna, and Dr. Ashok Venkat Narasu, a consultant endocrinologist, Sanjeevani Thyroid, Sugar and Hormones Clinic in Hyderabad. Thank you so much, doctors, for joining us today on the panel. Let me take my first question, which is regarding the endocrine system that controls most processes in our body from growth to sexual function. How does it affect metabolism? Dr. Ashok Venkat Narasu, if you could answer that.
Yeah, thank you for inviting us in this panel discussion on this special day. First of all, happy Women's Day to you and all our viewers. As you said rightly, hormones are really essential for the growth and development, starting from mother's womb to adulthood. Hormones are really essential. When it comes to metabolism, especially thyroid hormones, insulin, glucagon, and catecholamines and cortisol and other steroid hormones, really going to help us in the metabolism. When it comes to carbohydrates, the main hormone concerned with carbohydrate metabolism is insulin. So other hormones like what we mentioned earlier, these are concerned with the carbohydrate as well as protein lipid metabolism. When there is an imbalance in these hormones, their levels are at their action level. So it's going to cause the ill health. So they are going to cause either weight loss or weight gain. So we need to take certain steps to maintain their balance and their integrity at their tissue level in terms of having a proper action to promote the healthy life.
Now, obesity can be associated with several endocrine alterations arising from changes in hypothalamic pituitary hormones axis. What are those alterations?
First of all, happy Women's Day to all the viewers. As you said, hypothalamic pituitary axis is involved in the obesity pathophysiology, and we all know appetite center is placed in the hypothalamus, and multiple factors affect this appetite center, and that can lead to increase in the appetite because of multiple factors, because of mass effect, because of tumor, because of neurosurgery, and lead to increase in appetite. Other multiple gene factor also involved in the appetite center, and mutation in that gene factors can lead to increase in appetite and multiple syndromes of obesity. Also, there are hormone imbalances like excess cortisol, that is called as Cushing disease, can lead to increased appetite and weight gain. Also, hypothyroidism, low thyroid hormone can lead to obesity. Low gonadal hormone can lead to obesity, and growth hormone deficiency can lead to obesity. So, in obese patient, we need to search out the etiology and we need to treat the etiology. And if we treat properly, we can manage it very well. Thank you.
So, obesity negatively impacts the health of women in many ways. What are the causes of obesity in women? Dr. Kishore.
Thank you. And first of all, I would like to say Happy Women's Day to all the viewers. The causes of obesity It is primarily the acquired disease. It is a lifestyle disorders. The imbalance between the calorie consumed and the calorie expenditure made can lead to the weight gain and obesity. There could be many other factors that can contribute in obesity, like genetic predisposition. There could be some endocrine and hormonal imbalances could be responsible for that. For endocrine, you can have hypothyroidism, up to some extent hypogonadism, Cushing syndrome. These can also lead to the weight gain and obesity. And these weight gain has negative impact on the woman's health.
So, is maternal obesity linked to childhood obesity? What are the effects of obesity on maternal health? Dr. Venkat Narasu, if you could answer that.
Yeah, absolutely. Maternal obesity is going to increase the childhood obesity. Almost in a research analysis, it is found that near to 250% for rise in the childhood obesity if the mother is having obesity. So that is the reason we need to take each and every step to maintain the healthy weight in the mother during the childbearing age. So that is not only going to cut down the complications in the mother, but also promotes the healthy life in the offspring immediately after birth and in the rest of their life. So as we know, the obesity is linked up with diabetes and hypertension and other heart-related diseases. So if we are maintaining the healthy weight by means of having proper balanced diet and having regular exercise in the mother during their childbearing age, it is going to protect them as well as their offspring for their rest of life. So definitely it's going to affect. So we need to take each and every step to cut down the excess weight before planning for pregnancy.
Obesity is a common finding as far as women with PCOS are concerned. What is the relationship between obesity and PCOS? Dr. Nilesh Lamate.
Yeah. If we see multiple studies and if we found around 80% of PCOD are obese, and underlying insulin resistance is an important etiology in the PCOD, and insulin resistance lead to increase in the secretion of LH and testosterone, which lead to triggering factor, one of the triggering factor for the PCOD. So definitely obesity is one of the etiology for PCOD, and in management we need to reduce the weight, and weight reduction is a important one of the important treatment in the PCOD. Yeah.
Right. So is it true that if you lose weight, you can get rid of PCOS? Dr. Shyam Kishore.
Yeah.
38 to 88% of PCOS women are obese. A study has shown that, and obesity and PCOS are interlinked to each other. So if you are going to lose weight, you are definitely going to get rid of PCOS. At least if you lose 5% of your weight, you are going to have meaningful impact on your menstrual cycle. They are going to be restored. It will improve your ovulation. The ovulation will be restored, and there is a definitely decrease in the cardiometabolic risk factors. So definitely if you lose the weight, it will have impact on the PCOS. In addition to that, you should have a good quality of food, optimum sleep and optimum exercise so that you can get rid of your PCOS.
Right. With that, we are going to be slipping into a very short break on our show, but we'll be back with all our expert doctors on the other side. Stay tuned. Welcome back to our show. One of the leading causes of infertility in females nowadays is obesity. Is that true? And if so, then why so? Let's take this question to Dr. Ashok Venkatanarasu.
Absolutely, the excess weight or obesity is going to impact on fertility chances. obesity is going to cause almost threefold rise in the infertility. Basically, excess weight has the impact upon ova development, ovulation rate. Not only that, once the embryo is developed, early embryo is developed, so inner layers of uterus has to provide the friendly environment to have the proper receptivity and thereby development of the embryo. These things are going to be affected with the obesity. When the person is having excess weight, it's going to have the negative impact upon the hormones, which is going to cause the development of ova and thereby further progression to the fertility. So overall, the excess weight is having inhibitory effect upon the hormones which are concerned with the ova development and further process in the fertility. So that is the reason excess weight is one of the leading cause of infertility. We need to take the necessary action to curtail this obesity, to promote the healthy weight and thereby promote the natural fertility chances.
Right. So, as we discuss, obesity in women raises the risk of a number of severe and fatal illnesses. What is the ideal diet plan for women who might be obese? Dr. Nilesh Lomte, if you could take that question.
Okay. Nowadays, prevalence of obesity is rising, and for that we need to take a proper action. And for weight reduction, processed food should be avoided. Fat and oily food should be avoided. Fast food, junk food should be avoided, and intake of protein, fiber should be increased, and that should include salad, fruits, and in protein, eggs, chicken, fish, paneer, and sprout intake should be increased. And along with that, 30 minutes of exercise is must, and we need to reduce the calorie intake per day at least by 500 kilocalorie per day. And once we reduce the intake, then the stored fat is utilized for the energy requirement in the body, and weight can be reduced. So overall, energy intake should be reduced in the management of obesity. Right.
Now, why do women become obese after menopause? Can regular exercise make them lose weight? And if you could take us through the exercises that are safe. Dr. Shyam Kishore.
Obesity and metabolic syndrome are 3 times more common in menopause than before menopause. Definitely, there is going to be a hormonal changes around the perimenopausal age and around the menopause. So there is a decrease in the estrogen level, hypoestrogenemia, relative hyperandrogenemia. There is a decrease in sex hormone binding globulin level. In addition to that, the pre-existing disease to the lady, pre-existing medication to the patient, and not only that, they can have poor lifestyle. They are not carrying off their dietary activity, they are not doing enough physical activity, and that all can lead to weight gain around their waist. These hypoestrogenemia lead to primarily weight around the waist, and so these patients are advised to do proper dietary plan, and they advised to do proper exercise. In dietary plan, they should take the plant-based diet more, and they should advise to do aerobic exercises. And if they have not doing exercises in past, they should start exercises gradually with the starting 10 minutes exercise and gradually increasing more than that. So if you are more active, diet conscious, definitely you will get less weight.
Right. Why do women gain weight when stressed? Is there a link between stress and obesity? Dr. Venkatnarayan Rasu.
Yeah, absolutely. The stress is going to have the increased occurrence of obesity, because the chronic stress is going to promote the comfort eating of high calorie food. It is going to alter the food pattern and also promote the sedentary lifestyle. When the person is exposed to chronic stress, when he is in a chronic stress, the hormones like cortisol and other stress hormones will be elevated. These are going to promote the appetite center to take more and more food. So that is the reason they will have the cravings, especially for cravings for the high calorie food. And another important hormone, we call it as a ghrelin. It is the hunger hormone. The ghrelin levels also will increase. And another hormone called leptin, this will go down. The leptin is promote the satiety. It will cut down the hunger. The leptin levels goes down and ghrelin levels goes up, and other stress hormones will goes up. Ultimately, this will promote the appetite center in such a way to take more and more food. So the person will gain excess weight. So that is the reason we need to take each and every step to cut down the stress. A simple like doing some simple jogging or walking, or doing some prayer or reading some novels or inspirational books, and doing yoga and meditation. This will cut down the stress level. This will bring some happiness and peaceful mind to the individual. Thereby, it is going to cut down the stressful hormones, and that will maintain the appetite center in a normal manner. So the person will take the food as per their requirement. They won't take the increased food intake, and they won't crave for the high calorie food. So in a day-to-day life, we need to take the necessary steps to cut down the stress and to promote the happiness in the mind, to have the proper regulated food intake, and thereby healthy life.
Right. So does obesity cause early puberty in girls? Dr. Lomte.
Can you repeat the question?
Doctor, if you could answer, does obesity cause early puberty in girls?
Yeah. So in multiple studies, it has been found that obesity leads to early puberty in girls, not in boys, and that could be because of interrelated rise in the factor like insulin resistance and leptin release in the obese girls, and that stimulate the gonadal axis in the pituitary gland and leads to early menarche. Along with that, obese girls have early height spurt as compared to fellow girls, and also they have early puberty and menarche, and that could be related to interrelated hormonal changes. So yes, answer is yes, obese girl have early menarche.
Now, what is morbid obesity? What are the consequences of morbid obesity? Dr. Shyam Kishore, if you could take that question.
Morbid obesity, if you consider the two extreme of the normal human being, one is the normal weight, normal BMI. On the right side, on extreme, there will be morbid obesity. Morbid obesity is called class 3 obesity, and WHO had classified this morbid obesity in those who are having the BMI 40 kg per meter square or more than 35 with their comorbid conditions. So with the increasing obesity, you are going to increase the severity of the other comorbid condition. In those who are simply obese and in those who are the morbid obese, the severity of their comorbid conditions like diabetes, CAD, hypertension, dyslipidemia, obstructive sleep apnea, and many more will be much more. And these people are prone to need more medical assistance. They require more hospital admission. These people are they have impaired routine daily activity, and their medical expenditure increases. They need medical assistance. Not only that, these morbid obese patients are also prone to succumb to any infection if they are going to have in their illnesses.
Right. Well, it's the occasion of International Women's Day. Well, let me ask the doctors that we have on our panel today a message for all the women out there. Dr. Venkat Narasu, if you could, put out your message for the women on International Women's Day.
Yeah, the bottom line message is to maintain the healthy weight. So that promotes the definitely good health in the future, not only for the mother itself, for entire family, and more especially for their children. So to promote the healthy weight, one has to take the properly balanced diet, and at least spending some 30 to 40 minutes of exercise, that is in the form of walking or jogging or swimming or dancing, some form of exercise. And the stress relieving techniques like some meditation, yoga, or reading books, or doing some prayer, finding our own way of way to cut down the stress. So if we can do these things, definitely these will going to promote our health, not only our health, our entire family, and thereby our nation's health also will be in a better position.
So basically, find things to de-stress yourself, find things that make you happy is the message that Dr. Venkatanarasu has put out for the women. We also, I would like to take the same thing to Dr. Nilesh Lomte. Doctor, your message for the women on International Women's Day.
Obesity itself can lead to multiple diseases like diabetes, hypertension, dyslipidemia, PCOD, and so on. So to avoid obesity, avoid excess calorie intake, avoid fast food, junk foods, avoid weight gain. Along with that, at least 30-minute daily exercise is a must. And if we avoid the weight gain and obesity, we can prevent multiple diseases. So be cautious about weight gain. That's the message from my side.
Keeping your weight in check, eating healthy, keeping yourself happy. Some of the suggestions by the doctors that we have. Let's take, we also have Dr. Shyam Kishore. Sir, your message to the women on International Women's Day.
Not only the women, the entire family should have good quality of food. That should include the plant-based food, that should include your vegetables, fruits, and you should have the optimum exercise that must include 30 to 60 minutes of exercise and optimum sleep, and de-stress yourself. If possible, at least you do some yoga and meditation. That will definitely help you in losing weight, keeping healthy, not only you but your entire family.
Right. So eating healthy, keeping your weight in check, yoga and meditation, some of the tips by our expert doctors. Thank you so much for joining us here on the broadcast today. And with that, we're slipping into a very short break. News and updates will continue on the other side. Stay with us.